sore throat is the pain, scratchiness, or irritation of the throat that often worsens when you swallow. The most common cause of a sore throat is a viral infection, such as a cold or the flu. A sore throat caused by a virus resolves on its own. Strep throat, a less common type of sore throat caused by bacteria, requires treatment with antibiotics to prevent complications. Other less common causes of sore throat might require more complex treatment. Symptoms. Symptoms of a sore throat can vary depending on the cause. Signs and symptoms may include pain or a scratchy sensation in the throat, pain that worsens with swallowing or talking, difficulty swallowing, sore, swollen gland in your neck or jaw, swollen and red tonsils, white patches or a pus on the tonsils, a hoarse or muffled voice. Infections causing a sore throat might result in other signs and symptoms including fever, cough, runny nose, sneezing, body aches, headache, nausea, or vomiting. Now to the causes. Viruses that cause the common cold and the flu also cause most sore throats. Less often, bacterial infections cause sore throats. Viral illnesses that cause sore throat include common cold, flu, mononucleosis, measles, chickenpox, COVID-19, and croup, which is a common childhood illness characterized by harsh back and cough. Bacterial infections. Many bacterial infections can cause a sore throat. The most common is Streptococcus pyogenes, which causes strep throat. Other causes of sore throat include allergies. Allergies to pet dander, mold, dust, and pollen can cause a sore throat. The problem may be complicated by postnasal drip, which can irritate and inflame the throat. Dryness. Dry indoor air can make your throat feel rough and scratchy. Breathing through your mouth, often because of chronic nasal congestion, may also cause a dry sore throat. Irritants. Outdoor air pollution and indoor pollution such as tobacco smoke or chemicals can cause a chronic sore throat. Chewing tobacco, drinking alcohol, and eating spicy food can also irritate your throat. Muscle strain. You can strain your muscle in your throat by yelling, talking loudly, or talking for long periods without rest. Gastroesophageal reflux disease, GERD. GERD is a digestive system disorder in which your stomach acid back up in the food pipe, esophagus. Other signs and symptoms may include heartburns, hoarseness, regurgitation of stomach content, and the sensation of a lump in your throat. HIV infection. A sore throat and other flu-like symptoms sometimes appear early after someone is infected with HIV. Also, someone who is HIV positive might have a chronic or recurring sore throat due to a fungal infection called oral thrush, or due to a viral infection called cytomegalovirus (CMV), which can be serious in people with compromised immune systems. Tumors. Cancerous tumors of the throat, tongue, or voice box can cause a sore throat. Other signs and symptoms may include hoarseness, difficulty swallowing, noisy breathing, a lump in the neck, or blood in saliva or phlegm. The risk factors. Although anyone can get a sore throat, some factors make you more susceptible, including age. Children and teens are more likely to develop sore throats. Children ages 3 to 15 are more likely to have a strep throat, the most common bacterial infection associated with a sore throat. Exposure to tobacco smoke. Smoking and secondhand smoke can irritate the throat. The use of tobacco products also increases the risk of cancers of the mouth, throat, and voice box. Allergies. Seasonal allergies or ongoing allergic reaction to dust, molds, or pet dander make developing a sore throat more likely. Exposure to chemical irritants. Particles in the air from burning fossil fuels and common household chemicals can cause throat irritation. Chronic or frequent sinus infections. Drainage from your nose can irritate your throat or spread infection. Close quarters. Viral and bacterial infections spread easily anywhere people gather, whether in childcare centers, classrooms, offices, or airplanes. Weakened immunity. You are more susceptible to infections in general if your resistance is low. Common causes of lowered immunity include HIV, diabetes, treatment with steroids or chemotherapy drugs, stress, fatigue, and poor diet. Now, to the most important part of this presentation, the prevention. The best way to prevent sore throat is to avoid the germs that cause them and practice good hygiene. Follow these tips and teach your child to do same. 1. Wash your hands thoroughly and frequently for at least 20 seconds, especially after using the toilet, before and after eating, and after sneezing or coughing. 2. Avoid touching your face. Avoid touching your eyes, nose, or mouth. 3. Avoid sharing food, drinking glasses, or utensils. 4. Cough or sneeze into a tissue and throw it away, and then wash your hands. When necessary, sneeze into your elbow. 5. Use alcohol-based hand sanitizers as an alternative to washing your hands when soap and water isn't available. 6. Avoid touching public phones or drinking fountains with your own mouth. 7. Regularly clean and disinfect phones, doorknobs, light switches, remote, and computer keyboards. When you travel, clean phones, light switches, and remotes in your hotel room. Lastly, avoid close contact with people who are sick or have symptoms. Thank you very much for being with me to the end of this video. Kindly subscribe to my YouTube channel if you haven't. Recommend this video to your family and friends who might find this video informative. Till we meet again, take a very good care of yourself. Remember, you can also make a difference, and don't forget, Kofi loves you. Peace out.